Hi there, my name is Cheryl Crow. I've had rheumatoid arthritis for 18 years, and today I'm going to show you how I do my Actemra self-injection. First, I take the medication out of the fridge and let it warm up for about 30 minutes. I also need alcohol pads, a Band-Aid, and some people use a cotton ball, or I just use a rolled up tissue paper. Once the medication has warmed up, I take it out of the container and get the syringe ready and make sure that it's not cloudy and not expired. Looks good. Then I wash my hands. I'm wearing my compression glove right now for pain relief, but I'm going to take it off before I do my injection. Ready to do the injection, I get out my alcohol prep pad. I just make sure to get the area nice and clean. I have a choice between stomach or thigh. I really like to do the thigh. Personally, I find it less painful, but I know other people who find the stomach less painful. So it's really just all about what your own body feels like. So I pinch an area where I can feel a good amount of skin and get it nice and wet. And then you don't have to do this. This just gives you a sense of control, but you can let it air dry a bit. Now, I want to mention before I inject the Actemra, or I never know how to pronounce this, Tocilizumab. There we go. So Actemra or Tocilizumab also comes in an auto-injector pen form, or it comes in an infusion. In general, I actually like infusions because they don't have to be done every week. But in this case, because of the pandemic, I'm avoiding going to the hospital or the doctor's office when I can. So I get the needle ready, and I'm not very afraid of needles, but I am going to give you some tips afterwards about what to do if you have a needle phobia. So I target the area that I already cleaned, and I want to go in at a 45-degree angle. And this one is a little bit bigger or wider than some of my other medications, like the syringes for methotrexate, so it does hurt sometimes. And like I've shown in other videos, instead of pushing down with the thumb, I actually like to push down with the palm of my hand. That just helps because sometimes my thumb joints are tender. And it just kind of helps relieve extra pressure or strain on those. I go a little bit slow on this one, and then I get my little tissue and I put some pressure on the injection site, and it's pretty quick and easy. And then I just put my Band-Aid on. See, I can barely actually tell right now. I'm crouching so I can get in the view here of the camera, but I can barely even tell where I injected it. You also want to, of course, follow all the instructions given to you by your medical team, but you want to rotate the injection site so you're not doing the same one each time. Here's a couple tips for needle phobia. Now, I personally haven't gone through needle phobia. However, I have gone through exposure therapy for severe claustrophobia and claustrophobia, which is fear of being trapped. That's claustrophobia, and claustrophobia is fear of small spaces. So some of the principles that I learned when going through exposure therapy for my phobia was, first of all, going through exposure therapy with a trained counselor, psychologist, therapist is going to be very helpful for most people. Now you can try it on your own if that's what you're interested in. You have free agency over your life, but having a trained professional can be really helpful because exposure therapy is a bit unintuitive. For me, and I'm just telling you off the top of my head, and kind of from my heart and from my gut, that the most important thing was facing the fear and saying that I can deal with this. I can deal with the thing I'm afraid of, and I don't have to run away from it. So a lot of times for needle phobia, people suggest things like taking a deep breath and doing things to calm yourself down. Interestingly, for my experience of phobia, claustrophobia, I found that those things didn't work for more severe phobia. They worked for mild, like I'm mildly discomfort, I'm on an elevator for like one floor, okay, I'll take a deep breath, that works. But if you're having a more moderate to severe phobia, sometimes the nice sounding therapies don't always work because they actually reinforce this idea that you can't handle it. Like, I can't handle this needle, I need to take a deep breath so that I can handle it. But actually, when you go through exposure therapy, and this is the kind that I went through with my therapist, it was acceptance and commitment therapy, informed exposure therapy. But the idea is that you you expose yourself to what you're afraid of. So if it's a needle, you would, first you could do it in the stair-step manner, like just be in the same room as a needle. And then you can work up to, touching a needle. And then obviously the goal for self-injections would be ultimately to be able to inject yourself. But the idea is that you just say, I'm uncomfortable and I'm going to sit with this discomfort. And you think, well, why? Like, if you're feeling uncomfortable, why don't you just try to like do something to feel better, right? Like, do a strategy, do a tool to de-escalate. But it's really bizarre. But in this theory of exposure therapy, it's like the only way out is through. And that you again, when you do those things that take you away from what you're like, what they're afraid of, like again, the needle, or in my case, a small space, or feeling trapped, then you keep reinforcing this idea in your mind that you can't handle those things. So again, the idea is to expose yourself to the thing that you're afraid of and literally just allow yourself to feel the discomfort and then stay with it and not run away from it. Don't distract yourself. Don't try to, look the other way. You actually, and again, this sounds, I'm telling you that this is what worked for me for my phobia, and there's a lot of evidence of exposure therapy for phobias and OCD specifically. So you just allow that discomfort, and over time it has less power over you, because it's kind of like if you're trying so hard, like let's say with the needle, to not look at it, not think about it, it has a lot of power over you and control over you, versus building up your capacity or your tolerance for being able to say, yeah, I don't like this needle, but I'm going to sit with that feeling of discomfort and that I don't like it, and I'm just going to continue with this behavior that's important to me, which would be injecting yourself, if that's important to you. If you decide that self-injecting is not a goal that you want to be able to do and that you would rather have someone else do it, then absolutely go for that. So again, if you are pursuing or interested in pursuing things that will make the experience more comfortable or less painful, there is nothing wrong with doing, an analgesic spray, as long as that's okay with your medical team, or it's like icing the area beforehand. That could be helpful if the pain is what bothers you. For me personally, I don't find the injections that painful, so I don't do anything really special before them. So again, I'm not trying to play junior therapist right now. I'm just telling you the frame of reference that really, really helped me, and that you might want to think about if you've tried the kind of basic strategies, like take a deep breath or calm yourself or think about a happy place, or get your body. Certainly it can be helpful to get your body out of fight or flight, but it also can be useful to teach yourself that you can persevere and you survive despite the discomfort of being in the presence of your phobia. It's like a weirdly empowering thing that at first sounds very out there. Like when my therapist first said that, I was like, this is the meanest therapy I've ever heard of. Like, why? I actually remember asking him, how do you do this job? How do you make people go through the discomfort? And he's like, well, because I see that it works. He's like, I've had people come who've had OCD for 20 years and not made any progress in their former therapies, and they've never done exposure therapy before. And after a few months of exposure therapy, even though it's uncomfortable at first, their brain eventually learns that this is for irrational phobias. These are phobias that it's not actually doing any true lasting harm to you, to take your medication, right? In my case, yes, obviously there's side effects, but in general, this is not actually threatening me, So it's in the same way that somebody who wants to wash their hands 15 times, it's not going to be threatening their existence to only wash their hands once. So it's helpful to learn that the consequence that you're so afraid of doesn't actually happen. So anyway, that's my 2 cents on that, just because I know it's a frequently asked question. When I started doing injection videos, I literally was just doing them because I thought, it'd be nice for people to have it kind of be normalized and see someone doing the medication, because it's always kind of very dry. If you get those hospital produced videos, sometimes you just want to see a normal person, doing the injection. I didn't really think that people would be maybe feeling really stressed watching it. So I do apologize for not being sensitive to that before, even though I've been through my own therapy for phobias. I didn't remember how many people have a needle phobia. It's a very high percentage. So it's, again, you're not alone. It's not like you're weak or you're wrong for having it, but it is something that you can potentially, grow out of or learn to live with in a more comfortable way. But you have to first be uncomfortable. Again, it's very paradoxical. So that's it. And those of you who've seen my other videos know that I have lots of life hack videos, lots of personal story videos from the Arthritis Life podcast. So I'm always open for topic suggestions for more videos in the future. Bye.